Thank you for coming to our office to learn more about stem cells and regenerative medicine. In the next 10 minutes, I will teach you about this new life-changing procedure. In the past, this was only available in foreign countries using embryonic stem cells from aborted fetuses. But now, scientists have discovered the power of adult stem cells which are lying dormant in your body right now. Many years ago, when you were conceived by your parents, your mother and father mixed their chromosomes together to make one tiny cell. And this tiny stem cell was able to grow into the human being that you have become today. Scientists are excited about stem cells because they are undifferentiated cells, which means they have the ability to grow into other tissues. They can grow into nerve cells to repair your brain after a stroke, concussions, or dementia. It could repair nerves that have been damaged from an accident, chemotherapy, drugs, or surgery. It could grow into new cartilage, spinal disc, labral tissue, or meniscus to repair lost cartilage in your knees, hips, spines, shoulders, and other joints. If you are currently having pain from arthritis, which is just a loss of cartilage between your joints, this could be your solution to that pain. Stem cells have been used to grow and repair new muscles from partially torn rotator cuffs or partially torn ligaments in your knees. Some practices choose to stick with the aesthetic stem cell treatments and use it to rejuvenate the collagen, skin, and fat in your face to give you a natural, youthful look. Some focus on hair restoration. Stem cells have been used to grow hair on completely bald men and women as well. Some practices use stem cells for IV therapy, which is great for most autoimmune diseases, which is when your immune system attacks its own organs or nerves. This could be used for rheumatoid arthritis, lupus, multiple sclerosis, Hashimoto's thyroid disease, and other conditions. Some have used it to aid and repair damaged organs such as the kidneys, heart, lungs, and other areas that begin to fail as we age. I know you may be thinking, could this really be happening? Is this the type of treatment that doctors of future would offer, like on Star Trek? I'm sure if Dr. McCoy was real, he would be offering this type of treatment to everyone on the Starship Enterprise. It almost seems like these stem cells have a mind of their own, with intuitive knowledge to heal specific injuries. But there is an explanation for this process. Think of stem cells as the world's best construction worker, who has the ability to build virtually anything your body needs. But they are sound asleep. Scientists have discovered how to wake up these construction workers, but they still need the tools and blueprints to repair and build the body back to a newer state. The tools and blueprints are supplied by your body's growth factors, which are combined with your stem cells to form the ultimate construction crew. These growth factors, along with ones released at the site of injury, known as cytokines, tell the stem cells where to go in your body once they are deployed. If you have arthritis, a muscular tear, a stroke in your brain, damage to your heart after a heart attack, or just chronic damage from a disease process, you will have a cytokine response which attracts stem cells to the damaged area. As far as results go, some patients report results within days, but most will take weeks to months, and some may take up to a year to get the full benefit. We have had great results with patients in their 90s, and similar results with people much younger than that. There is an art and science to this procedure, and your provider will let you know what method is best for you. There will be some time before this is a fully FDA-approved procedure, but many procedures like Botox for wrinkles, aspirin for prevention of a heart attack, and blood pressure medication for migraines start out as a non-FDA-approved, off-label procedures for years or decades before their approval. In fact, some of those listed above are still waiting for FDA approval for their off-label use, but they are still widely used and accepted by many physicians throughout the country. One thing we know based on the safety data for this procedure is that it is extremely safe. The reason why these procedures are available to the public and allowed by any medical provider in the country is because of the safety data. While we can't guarantee that this may cure you, we do know that it is extremely safe, which is the first thing we assess when we add any new treatment into our practice. Now that I explained what stem cells are, let's discuss some of the specific methods some practices use. The doctor will explain which one will be best for you, but first, let me tell you about the methods. Amniotic fluid, umbilical cord, and placental regenerative allograft stem cells are a common source of regenerative stem cells and growth factors. The amniotic fluid is the liquid that surrounds the fetus and helps nourish the baby, which will have a high concentration of growth factors with some stem cells in it. The The placenta is the organ formed during the pregnancy that is responsible for providing oxygen, nutrients, and removing waste. This has quality stem cells, but won't be as potent as the umbilical cord with its cord blood inside. All of these will be collected from a mother who has given birth via C-section. Many of them have been screened in advance and have no diseases and are between the ages of 18 and 35. Normally, this would be discarded after delivery, but now we are able to gather this vital product and use it to save people's lives. The tissue must be collected, tested, and processed using a very rigorous FDA-approved tissue gathering, sterilization, and storage process. This ensures that there will be no adverse reactions, such as tissue rejection, once these cells are delivered. Some procedures take stem cells and growth factors from your own blood, bone marrow, or fat tissue, which are called autologous procedures. These areas of your body have been shown to have the highest concentrations of stem cells and growth factors in your body, and we call these adult stem cells. These cells are your own, which eliminates the chance of disease transfer, tissue rejection, and other potential issues. To extract the bone marrow, the doctor will have the patient lie on their side and numb an area around the side of the pelvis with local anesthetic. A small puncture with a drill will be made in the iliac crest, and bone marrow will be pulled out and typically mixed with blood growth factors prior to the deployment in the patient that same day. This will have a very potent and fresh type of stem cell in this product. Finally, we come to fat-derived stem cells. This is the newest method available in the US. Fat has an abundant amount of stem cells called stromal vascular fraction, which are basically baby fat cells waiting to be activated when your fat dies. The procedure uses about 2 ounces of fat, which is filtered many times and activated and eventually redeployed back into the body. To harvest the fat, the patient will be lying face down on the table, and the fat will likely be taken from one of your flanks and love handles after local anesthetic is applied. The incision will be less than half an inch, and the harvesting of the fat should take about 15 minutes. The incision is very minor and will not even require a stitch. Your provider may also discuss using a platelet-rich protein, known as PRP, or growth factor treatment for your specific problem. This is a lower-cost option, but it will not contain any stem cells in the solution. Growth factors are the tools and blueprints for the construction worker, but without the construction workers, you will not rebuild your body. Growth factors will reduce inflammation, heal up an injury, and will lay down a fibrous scar over arthritic joints, which will act like a temporary cushion in some cases. With all these procedures, there is virtually zero downtime, and many people see results within weeks without the risks of surgery. I know this might be a lot of information. I know that you are probably tired and frustrated that you're in pain or not well. I would be too. No matter how bad things get, you have to keep looking toward the future. You have to keep searching for the solution, otherwise it's only going to get worse. I have been helping patients for a long time now. I have seen how great advancements in technology can be. This is why I'm so passionate about what I'm able to do for my patients. To be able to give them their lives back is priceless. To hear the stories of how they were able to play with their grandchildren or being able to take a walk with their spouse makes it all worth it. In a few minutes, one of our team members is going to come in and go over your results. Hopefully it's good news and you're a terrific candidate for our process. I know life is probably tough right now, but I want you to hear from real people how it is possible to overcome these challenges. It has been my pleasure to be able to spend these valuable minutes with you.
I had back pain for 22 years. It was a way of life. I decided to do the stem cell procedure and my life changed overnight. I got out of bed by myself, I was walking again, and no more pain pills.
I've had 3 total joint surgeries, and that's when a friend recommended that I try stem cell treatment. Well, it was the best decision of my life. My golfing is back. I'm moving like I did when I was a kid, and I highly recommend it.
I suffered from chronic joint and nerve pain. There was nothing that could be done for me except for medication until I found this place, and I participated in the stem cell research. It literally saved my life. I have my life back. If you feel your life is over, try it.
Hi, my name is Tony Apolito. I injured my knee back in the 60s in a motorcycle accident, and over the years it got worse and worse. And I got to the point where I'm a golf teaching professional, and I could hardly do that anymore. And I came in here about a year ago to see Dr. Hashimoto, and I started with some other kind of injections, and that worked okay. But then I read about the stem cells, and I decided to do it. And that was only 3 weeks ago, and I can't tell you what a difference it's made. At least 50% difference right now. I played golf today. Normally I'd be pouring myself into the car and barely making it into the house, and I'm walking around perfectly right now. The pain is gone almost completely. It's like a miracle. It's the best thing I've ever done for myself. So I recommend it wholeheartedly.
Okay, so before I had stem cells, it's been years and years and years of pain and inability to walk, inability to, I work and everything, but I was using a walker at this point to even be able to go into work. Very difficult getting out of a chair. For those who have knee problems, you know what I'm talking about. Even just if you sit for 5 minutes, you're so stiff, you just can barely move. And it's pretty horrible, actually, way to live. Excuse me. So I was told that I needed both of my knees replaced. And that stem cells, I was way too far gone for stem cells, way too far gone, and that wouldn't work for me. And that was in San Diego. But and the doctors were great doctors, no question, but they just really didn't want me to spend the money to work on that if they didn't think it was going to work. And I thought to myself, no, it's got to be I got to try this first. This is much better than getting both of your knees fully replaced. It just got to be better than that. God brought me here as far as I'm concerned, but because I was driving around in the parking lots and I saw this place, I go, oh my gosh, it's like an oasis. And just decided to call and get some information on the stem cells. And everybody here was so friendly and so inviting and warm, and you know, I got a lot of information as well off of their, so finally I did it, and it was just amazing. The results have been amazing. The first afternoon that I did it, I was better. I mean, I could feel the difference, and I thought, well, maybe it's just mind over matter, you know. But it wasn't. It's kind of like the feeling that I'm getting from this. I can get out of a chair now after sitting for 5-10 minutes. I can get out of the car after being in it for an hour without any pain. I mean, I'm still pretty weak muscularly, but I don't have the pain. The pain's just not, I can't, I can cry if it's like, because I've been like this for so long, decades. And in one form or another, just really have been struggling with this for a very long time. So, I mean, it's a miracle to me, science to them. But I cannot tell you, if you're sitting on the edge trying to think of whether you should do it, don't even think about it, just come do it, because you just don't have any idea how much better you're going to feel. And nobody can guarantee the results for everybody, and I understand that, but they told me I was too far gone to even try this, and it would be a waste of money, and it was the best money I've ever spent, ever.
I've had joint pain for 20 years, really suffering. Stem cells were my last hope before surgery.
I suffered from chronic nerve and joint pain. There was nothing that could be done for me except for medications until I found this place.
In 8 weeks, my shoulder pain is virtually gone, and my knees are well on their way.
And it literally saved my life. I was able to walk again. I'm able to have a life again.
I would recommend it to anyone, and it was much more affordable than I thought.
I'm Dr. Olasnicki.
And I'm Dr. Hashimoto.
Call the number below to see if stem cells can change your life.
My name is Deanna Cherry, and I came into Dr. H about 1.5 years ago because I was having knee problems, shoulder problems, couldn't bend my right knee at all, and I had the stem cell procedure done. And in about 11 to 12 months, I started noticing that my knee was functional again. My shoulders are really a lot better, and I took the nitric oxide, and I did all the things that he told me to do, and I am doing better, and I really would highly recommend it to anyone who's having a lot of pain in the knees, shoulders, and other areas.
I first heard about stem cell therapy from my friend Tony, who had a really amazing response to this process. I thought I would try it on my hip. Well, it's only been 3 months, and it's already 50% better. And something that came along with it, which I wasn't expecting, was that I had arthritis in one finger, and it's completely gone. And my skin has actually gotten more moist, so I'm loving it.
I'm Dr. Olasnicki.
And I'm Dr. Hashimoto.
Call the number below to see if stem cells can change your life.
I'm really thrilled that I did this.
I had encountered some bad knee issues back in September of 2016. As a result of having stem cell procedure at Desert Medical, I'm now pain-free.
I have so many friends that are my age. I mean, we're all in our 70s and we're getting aches and pains. And you know what? Stem cell works.
I've been able to avoid surgery on both my knee and my shoulder.
I'm Dr. Olasnicki.
And I'm Dr. Hashimoto.
Call the number below to see if stem cells can change your life.
It is the wave of the future, I'll guarantee you, and I'm so grateful I got it done.
My daughter has special needs and she was suffering from chronic knee pain. At times she was unable to tell me, but just looking at her I knew she was in distress. I didn't want to see her in a wheelchair one day or have surgery, so that's when I discovered stem cell therapy, and I'm going to tell you it worked.
I'm Dr. Olasnicki.
And I'm Dr. Hashimoto.
Call the number below to see if stem cells can change your life.
We chose stem cell and it worked, and she's pain-free.